Good day, everyone. I am John Lloyd Vasquez, Bachelor of Physical Education, Year 3. At this point of time in this video, I'm going to report one of the eating disorders, which is Anorexia nervosa. Let's discuss first the learning objectives. First, understand the anorexia nervosa. Second, explain the symptoms of anorexia nervosa. And the last one, reflect on the causes of anorexia nervosa. Let's have first an activity before we go on to our discussion. This activity is called an essay. Answer the following question. Number 1, how does eating habits helps our body in achieving good physical health? Number 2, what is the importance of eating habits to people? So, you are going to answer this on your answer sheets. Afterwards, if I'm done reporting, then you will pass it to me or I will collect it. Next, so who among you here has an idea about anorexia nervosa? So when you say anorexia nervosa, it is also called as an eating disorders. So let's define first what is anorexia nervosa. So anorexia nervosa is an eating disorder that can result in severe weight loss. So it may leads to, if you lost a lot of weight, then it's considered as anorexia nervosa. Another definition, anorexia nervosa is a serious mental health condition and potentially life-threatening eating disorder. So this is such a serious mental health condition. Why is that? Because based on the research, this eating disorder has no cure or there is no medication at all. There is no proven study that can cure to this disorder. So let's discuss the symptoms of anorexia nervosa. The symptoms are inability to maintain a normal weight. So your weight is not normal or you are imbalanced. Second one is fatigue. Third, skin that is yellow or blotchy and covered with soft fine hairs. Second, the last to the second is hair thinning or falling out. So if you have loose hair or falling hair, then it could be the symptoms of anorexia nervosa. And the last one, more than 3 cycles without a period. So if you are a girl, then you're experiencing 3 months without period, then that can be considered as the symptoms of anorexia. Now, let's move on to the behavioral symptoms of nervosa that's considered as people behavior towards this disorder. Excessive exercise, even though you are not fat or you are healthy, but you continue to do exercises. Next is pushing food around the plate instead of eating it or cutting food into small pieces. So you are rejecting the food. You don't have an appetite to eat. So that is one of the symptoms. Next is irritability. You are irritable for different situation. Even a single period of thing, you become irritable. Next is withdrawal from social distancing. Example, your family or friends have gatherings, then you used to neglect it. So that is may cause also or consider as the symptoms of anorexia. Next is depressed mood. We used to have depression. Last is hunger denial. Example, if you are hungry or you experience starvation, then you used to neglect it. So that is one also of the symptoms of anorexia nervosa. Now, what causes anorexia nervosa? So you may think that where come from or what is the origin of anorexia nervosa or why it is happening? So now, let's discuss the causes of anorexia nervosa. What are the causes? The causes of anorexia nervosa can be classified into 3. First is biology. Genetics and hormones might have an effect on the development of anorexia nervosa. For example, in your genes or hormones like genetic from your mother or father, or it's in your genes that you may be experience this kind of disorder or anorexia nervosa. So therefore, if your parents experience this disorder, then therefore, you as a child, there's a possibility to become or to have an anorexia nervosa. The second factor is environment. Pressure from society to look thin may also contribute to the development of anorexia nervosa. Example, if I am fat, then my environment or my circle of influence, the people under my circle of influence keep on pressuring me to used to have balanced diet, then I overuse it, then therefore that one also considered as the causes of anorexia nervosa. The last factor would be psychology. Someone with obsessive compulsive disorder might be more predisposed to maintaining the strict diet and exercise regimen that those with anorexia nervosa often maintain. So psychology, we are thinking that I don't want to eat. So that kind of instinct may cause to anorexia disorders. Maybe you are experiencing obsessive compulsive disorder that you are very particular with your diet, very particular to your figure. You don't want to become fat, or you don't want to your body to expand. So that is one also of the causes of anorexia disorder. So we should always remember that there are three factors that we should consider when it comes to the causes of anorexia disorder. First is the biology, second, environment, and the last one, psychology. Now let's proceed to how is anorexia nervosa diagnosed? How it being diagnosed? So, first one is restricting food intake. You lose your appetite, or you don't have appetite to eat. You used to reject food, or you used to deny your meal. So that is one also that you may be diagnosed to anorexia nervosa. Second is fear of gaining weight. You are afraid to have that oversize, or to have that regular weight or balance to your weight. The third one is problems in body image. Yes, this is very rampant nowadays. Youth are very conscious in terms of their body figure. So if you have problem with your body image, then like you are looking so very thin, and then therefore you consider yourself as diagnosed of anorexia nervosa. Next is what treatment is available for anorexia nervosa. So you may think that if I am experiencing that kind of disorder, what treatment should I do in order to cure that disorder? There are three classification also, or treatment of disorder. The purpose of treatment is that to gain weight, and of course to maintain our physical fitness capability. First is the therapy. Therapy consists individual, family, and group therapies are often an integral part of treatment. We have three therapies under therapy. We have individual therapy, family therapy, and group therapy. So when I say individual therapy, these are the therapy that we used to gain from our parents, from our friends, that we need to discuss with each other. Second is family. It's very important that upon dealing this kind of disorder, the family is very supportive to you in terms of your doing or in terms of your disorder. The last one is the group therapies. If you experience this kind of disorder, then therefore you need to relate to those people with same situation or experience. The second one is medication. While there is no medication at this time that is proven to treat anorexia nervosa, antidepressants we prescribe to deal with the anxiety and depression common in those with anorexia. So as of the moment, there is no medication of this disorder. The second one is, the last one would be hospitalization. Depending on the severity of your weight, lose your primary care provider, we want to keep you in hospital for a few days to treat the effects of your anorexia nervosa. So you may go to hospitalization if you experience severe weight loss. That is the moment that you go to hospitalization. So that's it for my discussion for today. For your assignment or extension of learning, you will create a collage making, make a prevention collage that states on how to prevent anorexia nervosa. Your collage will be graded to the given criteria. Content, 40%, creativity, 30%, organization, 20%, uniqueness, 10%, a total of 100%. Thank you everyone for joining or participating for my report. Wish you all the best. God bless and keep safe. Thank you.